So hello and welcome you all to Sail to MDS Dental Academy. I am Dr. Malay Trivedi, pediatric dentist and assistant professor in College of Dental Sciences. So as today we are going to discuss an important thing, that is how to plan revision for NEET MDS in this last 70 days. So we are going to talk about planning, how you have to study and everything in this video. And at the end I am going to provide you a few important key points that you have to follow this 2.5 months for the success of your examination. So student, today we are going to see about revision timetable. Before that, I want to tell you one thing. I have made one video how to plan in 70 days, in which I have divided the subject in 4 categories like long subject, short subject, pure basics and interrelated subject. So aspirant, those who want to plan independently or they want to make their timetable by themselves, they can go through this video. The link for that video is given in the description box and also in the I button above. So now in this video I am going to provide the revision timetable. This timetable is for all the students, those students who are part of my academy. As we know, we have completed the course in the month of August, so you people have started the revision earlier only, but this timetable will help you to go for one more revision. And also for those students who are not part of my academy and they want to join, they can go through this. And also for the students who are preparing independently. So in this lecture I am going to provide a revision timetable. We are going for the new batch from October 10, that's a prime batch for your last minute preparation. That schedule I will provide. I will tell you how you have to study, what to study, how I will conduct the lectures and exam, and the key points for the coming days. So aspirant, let's see the timetable, that how you have to plan yourself. So aspirant, you can see we have the prime batch for this coming 3 months. So we have the test series. Those students who want to just join test series, they can join test series. We have more than 40 papers, including all past papers of the NEET, INICET, SRship papers. Then we have the lecture and test series with more than 30 lectures. So you can see aspirant, we are starting from the 11th October. So I have given the approximate, the needed time for the particular subject. Like you can see oral pathology, we are going from 11 to 15. So we are going for 5 days of the oral pathology with the 2 lectures and the 2 exams. And remember, our lectures are being in such a format that the important key topics are given. You can go through all the important key topics for your examination from my lecture. And also the papers are very highly. No questions are repeated from your Pulse or Gauri Shankar. All new questions will be provided to you. Then for 2 days we have the general path and the practice test. So in total we have 3 days for the general pathology. Then we have the 2 days for the DADH. Then PPM1. So how we study physio-pharmacy medicine in the interrelated manner. We know many case-based questions will come. So if you know properly, physio-pharmacy and medicine will be known to you. So let's say we study CVS of physiology, at the same time we study the pharmac and medicine of physiology. So you can remember them in easy way. Then we have the oral radiology lecture. Then we have the exam for the same. Then we have the lecture on the endo and the operative dentistry, exam for those subjects. Then we have PPM2. Then we have the journal and the oral surgery. Then we have the PPM3. Then the exam for the journal, oral surgery and PPM3. Then we have the orthodontics 2 lecture. Then we are going to have the lecture on pedodontics along with the exam of ortho. Then we have PPM4, then exam of pedo. Then we have the microbiology 2 days. Then we are going for the periodontics. We are given around 3 to 4 days for the periodontics. Then you can see the anatomy, embryology and the osteology. Then we have PPM5. We have the biochemistry in the simplest manner with all the new concepts. Then we have the good lectures for your prostho, that's FPD, CD, RPD. And remember, I'm going to deal with the corresponding endomaterials, and the corresponding endomaterials of the endo and the operative will be deal in those subjects. So we have 4 lectures for the prostho and endomaterials, and the corresponding separate exam for the RPD, CD and the FPD. Then we have public health dentistry. All the important MCQs are provided in the examination. Then we have the lectures on the implant. So 7 December I'm going to complete everything for you. So your one revision you can complete. So this timetable you can follow for your revision pattern. You can start with the oral pathology and complete in 5 days. Give the exam, which is a must for your revision to where you stand. So till 7 December we are going to complete everything. The exam probable date is around 19 December. Then from in December we are having the practice papers, and you can practice the past paper of the 2019, 2020, 2021 NEET. Remember, don't do many past papers. 5 years are more than enough. Max 3 to 5 years. Don't go more than that, because from past papers you cannot expect question. No, previously before 5-7 years from past papers around 70 to 80 question comes, but nowadays that frequency has been decreased to 5 to 10 years. You can take out any past papers of the last 2 years. You can see hardly 5 to 10 repeats. So focus on past papers, but don't go for more focus. Then we are going to practice SR sheet paper also, in which the questions can come. All SR sheet paper of the subjects will be provided to you. And then we have the good grand NEET test. So along with the above test, we are going to provide extra practice papers also, and also the other past papers will be provided to you. And every week we are going to have the good healthy MCQ discussion, in which all of the students will be participate, so you can know how much you have to cope up and how you have to grow. So that was about the timetable aspirants. Then we'll see how to start studying. Please don't just start with the MCQ. Remember, one MCQ gave you one concept, or you can solve one MCQ. But if you know the concept, from that concept you can solve 5 to 10 MCQs. So first you have to read the synopsis of the Pulse, and if you are part of my academy, read the lectures. Okay, go through the lectures, in which we are going to provide images, video, audio, voice notes that help you to study image-based question together also. So we have synopsis and notes. The first thing you have to read that, then you have to read the MCQ, and at the end you have to do the revision. The revision is must. If you fail in doing the revision, then whatever you have studied will not be able to put yourself in the examination. So revision is must. How much you study, try to revise that. So you can follow this pyramid, that is synopsis, my academy notes, followed by MCQ reading, and then revision. Then aspirants, we are going to see how to study. Nowadays, as we are near the examination, you have to give at least 12 to 14 hours. Those who are in the internship, please, you have to study 12 to 14 hours. Anybody working in the clinic, please try to give very less time to the clinic, focus more on the examination. Anybody who have the clinic and practicing, try to devote more time for the study. At least 12 to 14 hours you have to give. And I am playing, don't study without any direction. Have the direction, okay, because to study effectively is very important. So first of all, when you start the day, you can go with my lectures, that is whatever the lectures I'm going to share you can study for 3 to 4 hours. Then for 1 to 2 hours you can read synopsis. After that you can read the MCQ. So that will help you. Let's say you're starting today with the oral pathology. Let's see my lectures for 3 to 4 hours. Then go with the synopsis for 1 to 2 hours. Then you read MCQs. Automatically the things will get imbibed in your mind. And then first revision. Before you end up your day, at least give 1 hour or 2 hours to whatever you have studied throughout the day. That will help you to convert whatever there is in your short-term memory to long-term memory. Sometimes when we read something, we remember for 2 to 3 days everything. But as the week pass, days pass, you tend to forget. That's why this first revision on the same day will help you to remember for a longer period of time till your examination. Remember, no new topics. If you open the Instagram, if you open the Facebook, Telegram, new topics keep on coming. But remember, to get ranked, to be in top 300, not new topics will help. The old and the repeatedly asked topics, the basics is going to help you in clearing that examination. So stick to the current basic books and don't go for the in-depth study. I have seen some students reading aeronautics, like they will study in in-depth. Now time is not there, 75 days are there. So don't go in excessively in-depth study. You have to cover all the subject. Even if you leave one subject also, you are going to lose 7 to 8 MCQ, and that will fetch you around 200 to 300 ranks. So please aspirant, balanced study and effectively study is so much important. Then how we teach in our academy. Remember, we follow all the latest exam pattern. We have the online lectures and concept based learning. So aspirant, lectures, we are going to have first formative lectures, that is WhatsApp based lecture, WhatsApp based lecture, which you can access anytime, anywhere. You can download in your mobile and you can watch whenever and wherever you are. We provide images, high text, voice notes and explanatory videos. Then we have few online lectures in which I am going to share you the important topics. Then we have the exam format. Remember our exam format, no need for laptop. In your mobile only you can give examination. We have past papers, progress unit test, PPM, subject wise papers and the practice test aspirant. Then Remember aspirants, I am there with you for your planning. If somebody wants customized planning, they can approach me. At every step of a preparation in this 75 to 80 days, I will be there with you. Even after the preparation for your seat selection and everything, I will be there for my students. Okay aspirants, so that was all about how to plan your revision. And now key points to remember. Don't read only MCQs. As I have told you, the one MCQ will give you one concept only, but the concept will help you in learning many MCQs. Don't read only clinical subject. There are pundits in the YouTube, there are people that will tell you read clinicals, you will get the rank. No, clinicals cover hardly 60 to 65%, but the remaining 35 to 40% is your basic subject. So if you leave that subject, you're going to leave 35 marks, then don't expect good rank from your side. Revision is must. So whatever you study, you have to revise and know new things that distract you from the core. Okay, so don't go for reading new. If you see in the Instagram, Telegram, or some of your friend of telling you, and don't do any such thing that distract you. Okay, then don't focus extra on past papers. I told you past papers have the importance, but don't focus more and more. I have seen students just reading the Neeraj Vadawan last 15 years paper, then they are telling me sir rank aayega. No, it will not come. The past papers will help you to know how the question is there. You can practice. They will help you to know the repeats, that 10 to 15 repeats will come. I should not go wrong in that. Okay, but remember the new questions examiners are setting. Don't analyze yourself more and more. You know, some students are starting, if at all starting right now, they analyze, oh my friend has studied this much thing, I have studied this much thing, whether I'm going to get rank or not. So please aspirant, don't do that mistake. Keep on improving every day till the day of your examination. And the biggest mistake my students are doing, they go for the lectures, they go for the synopsis, but they don't practice exam. You have to practice exam before you go for the main exam. The pattern of selecting the questions, the pattern of reading the questions, all that will help you if you practice around 25 to 30 exams, and you are providing more than 40 exams aspirant. So please practice and practice. Then aspirant, remember we are starting from the October 10, our new batch till your examination. To join, you can DM me, you can email me, you can go our website also. And any help in your planning, whatever doubt you have for your coming NEET examination, please be free to approach me. Till then aspirant, take care and take care of your health also.